Right now, we want to talk about Breast Cancer Awareness Month. Of course, October is Breast Cancer Awareness Month. A new survey, though, revealing a troubling statistic: 80% of women report that they're afraid of getting screened for cancer. So, joining us this morning via Zoom live, Dr. Ifenyua Stitt, a board-certified OBGYN and expert in breast cancer risk assessment, and Jody Lavery, who made the life-changing decision after learning about her own genetic risk. Ladies, good morning to you.
Thank you for having us. Good morning.
Absolutely. Thank you for joining us. I love seeing all the pink. Very nice to see. Um, Doctor, let's talk about this survey that revealed 80% of women are afraid to get screened, yet most say testing would actually reassure them. Explain this contradiction.
I think that so many women we're busy. We are so busy. We are involved in our children's lives. Oftentimes we're part of the sandwich generation where we're also taking care of elderly parents. We're involved in our communities, in our careers, in our jobs. And we have a very delicate balance of kind of keeping all of those things, all of those balls being juggled in the air at the same time. So oftentimes, number one, our health care gets put on the back burner because we're taking care of everybody else. But I think there's also a fear of getting bad news and having some additional thing to kind of disrupt that very gentle balance that we have. What I try to encourage my patients is, you have to know what your family history is. You have to know what's potentially around the corner because either way, you're going to get there. So ideally, it's important to, have the conversations with your families, getting that family history so that your providers can do the best job that they possibly can do in helping to kind of stave things off and potentially provide, life-changing alterations to make sure that you are able to keep that fine balance in tune.
So we do hear about screenings, but this layer of genetic testing, explain what that involves and who should consider it.
So, one of the things, and Jody will share her story, because I think that really exemplifies exactly what we're talking about. But as we are heading into the holiday season, we have a great opportunity to really talk to family members because we will have all these wonderful get togethers where we talk to family members to identify who might be, if we potentially have a family history that's concerning. Things that we look for are family members we have a similar cancer on the same side of the family, a specific cancer that multiple people might have. Or that young people who are under 50, who typically don't get cancer when we start hearing about cancers in younger people. Or we have rare cancers, things like pancreatic cancer, ovarian cancer, breast cancer in men. All of those are are fairly rare. So when we start kind of hearing those type of scenarios, that's a red flag to the providers, and we encourage each of our patients to share that because you might be a candidate for hereditary cancer testing. MyRisk hereditary cancer test is it's the leader in the industry. It's been around since the 1990s and it's been constantly modified, and it gives us the most accurate assessment of what's going on. And we use that as an extra tool, as a vital sign, so to speak, when we're trying to identify those patients who we might need to modify their medical management.
And Jody, you did have your own risk. Did you know about your family history with cancer?
I did. My grandfather had male breast cancer, his mother. So I knew I had a long history of cancer. And when I shared that with my provider, she offered the MyRisk hereditary cancer screening test. And although I was apprehensive and scared, I knew I needed to know the information. So I went ahead and had the blood test done. And it did come back that I was BRCA2 positive for the mutation. And with that knowledge, it gave me peace of mind because I was able to take control of my health and be able to make decisions on how I was going to handle the results.
And you made some major decisions there, Jody. And so, how are
I
you doing
did.
now?
I'm doing wonderfully. I did have my ovaries removed. I had a bilateral mastectomy. So I don't wake up every day wondering if I'm going to get a cancer diagnosis for those cancers. I also encourage my daughter to get tested because she does have a 50-50 chance of having the mutation as well. And she did. And she went a different route. She decided, because she doesn't have a family yet, to do the advanced screenings and not do the preventative surgeries like I did. And that's okay. But having the knowledge and being empowered to make those decisions for yourself is what it's all about. And I think it's very important for us to have that knowledge.
And doctor, so what does this entail? How does it differ from a standard mammogram or standard breast cancer screening?
Great question. So for those patients who are at risk, somebody like Jody and her daughter, her daughter, for example, is going to get more additional surveillance. Mammograms are really meant for patients who are of low risk for breast cancer, but those patients who are deemed at high risk for breast cancer, even those who may not have a mutation, who just have a stronger family history, may need to get additional imaging like MRIs. Something like for in Jody's case, they're also not just at risk for breast cancer, but also ovarian cancer. So one of the things that her daughter is going to also be getting is ovarian cancer surveillance with ultrasounds and a test called a CA-125, which is a blood level that will keep an eye on if there's any excess or abnormal activity in her ovaries. So each patient gets an individualized, a program to try to make sure that we are trying to keep those cancers that we're concerned about away as best as possible if they opt for surveillance, which is certainly very appropriate in a young woman who hasn't had a family yet. And then in Jody's case, where her family is complete and she was ready to make a decision to do something preventative, taking the surgical option. So what's great about, being able to, have the information from the MyRisk hereditary cancer test is each person gets to make an individualized plan for their care. It's not a one size fits all.
All right, Dr. Stitt, Jody Lavery, thank you so much for joining us this morning and for sharing your information and your story. We appreciate your time and appreciate sharing your story and honesty. Appreciate it.
Thank you.
Thank you for having us.
All right.